Thank you, Alex. It's a real pleasure to be with you. It's an honor to be asked to join, and hope everyone's doing well. What I'll do in the kind of short time I have is I wanted just to give a quick update on COVID, talk about where we are with the numbers and what's going on, particularly in Jefferson Parish. I'll talk a little bit about what I see the risks are going forward, where we see things going in the next few weeks or months, how I see it affecting businesses, and then I'll be sure to leave some time for questions at the end of it. So at this point, as of today, this morning, we've had over 17,000 cases of COVID in Jefferson Parish. We've tested almost 200,000 residents of Jefferson Parish for COVID, and 564 individuals in Jefferson Parish have died from COVID-19. The trajectory in the state of Louisiana for COVID is unique across the country, and that we're bimodal. We had two peaks. Not really no other state has experienced that. We had what we remember well here, a very, very large spike in the end of March, beginning of April, that really was focused in this region, in Jefferson and Orleans. That died down. And then later, about a month and a half ago or 2 months ago, we had a second peak that was larger in magnitude and also geographic spread. That really was a statewide peak that included Jefferson Parish as well. So that's a unique trajectory. It speaks to the amount of risk that we have here. Now, I think a lot of us are going through COVID fatigue. I certainly am, to be honest with everyone. It's hard. One of the things that makes it even harder is that we're still in the middle of it. We still have a while to go. I'll talk about a vaccine in a little bit, but nothing's going to happen quickly. So the point I'm trying to make is that it would not be impossible to have a third peak. In fact, that's what folks in the health department are worried about, and there's enough risk out there. So I say that by way of just a warning that there's a lot of potential risk out there to come, and we're going to have to be thoughtful about how we continue with the reopening and the getting back to life, which we're all really longing to do. Jefferson Parish, over the past few weeks, has done quite well, and to be honest, has beat the expectations of a lot of folks. For the first time in a long time, the percent positivity in Jefferson Parish, the percent of all tests being done that come back positive, is below 5%. It's at 3.8% for the past week, which is really encouraging. That's down from 5.5% the week before that, 6% the week before that, 6.8% the week before that. So it's really encouraging news. It is beating the rest of the state right now. It's lower than the state average. And it is indicative that the measures the parish has taken, namely promoting masking, promoting distancing, the early closure of the bars, as difficult as that was, has been effective. And for me, as a public health practitioner and as a doctor, it is heartwarming to know that the things that we can do are effective. We have a lot of agency in this outbreak, and COVID does not spread unless we let it. So it's good to know that the measures that are available, the toolbox, so to say, are effective. And I'll tell you, in Jefferson Parish, up until a couple of weeks ago, led the state in any number of measures. And it does not lead the state in a bad way. I mean, it had the most cases per capita. And it does not anymore. And that's really encouraging. And the credit goes to the leadership of Jefferson Parish and the residents for doing the right thing, even though I know it's difficult. Some of the less encouraging aspects of this outbreak are how it is affecting different people differently, particularly racial equity. And that continues to be an unfortunate hallmark of the pandemic, both across the country, in Louisiana, and here in Jefferson Parish in the greater New Orleans area. To illustrate that, in Jefferson Parish, 47% of all people who have died from COVID are African American, despite representing just 28% of the population of the parish. Very similar numbers to the state. 46% of deaths in Louisiana are African Americans, compared to 33% of the state's population. This is similar to what we see across the country, and there are two reasons for this. Dr. Fauci, Tony Fauci refers to this as the double whammy. Number one, people in marginalized communities, particularly African Americans in this part of the state, are more likely to have serious underlying health conditions. Rates of diabetes are higher, rates of hypertension are higher, rates of obesity are higher. When people have more underlying health conditions, it puts them at greater risk for bad outcomes if and when they do get COVID. So that's number one. Number two, people's exposure, people's risk of exposure to COVID typically goes up the more marginalized or vulnerable they are. When we think about what jobs people have, and if you have the luxury of being able to remote into your job, being able to perform your job at home via Zoom is a luxury that you don't have if your job requires you to be on the front lines. And if your job requires you to be on the front lines and you have to take public transportation to get there, that's another exposure risk for you. And if you live in a multi-generational house, a lot of people, that's another exposure risk for you. So what we see is that people from marginalized communities are at higher risk of just being exposed to the virus. Those two things combined, we think, have led to these racial inequities that we see, and it's very concerning. There's nothing unique about Jefferson Parish. So Jefferson Parish fits right in with what's happening across the state and country, but it is important to note that. We'll talk about the vaccine for a little bit. I know it's been in the news the past couple of days. It's also been politicized a lot, and I think that's very unfortunate, because there's a saying in the public health world, particularly with vaccines, that it's not the vaccine that's important, it's the vaccination. Meaning that, whenever we do get vaccine produced and distributed, if there's not a high enough level of vaccine confidence out there, if not enough people get it, that it's obviously not going to do any good. The timeline is both encouraging and also humbling of this. And encouraging because this vaccine is being produced faster than any vaccine has ever been produced before. And the federal government, in addition to really expediting the trials, has pre-ordered vaccine before the data is even there, so that if a vaccine is proven safe, that company has already been paid to start producing it at volume. That's something that we haven't really done before either. So this is being produced at very quick pace, and that's really good news. The flip side of it, though, is despite kind of what has been put out there and how it's been politicized, we are not mere weeks away from having vaccine available to the general population. We're just not. And Dr. Redfield, the director of the CDC, talked about that yesterday when he testified to Congress. The CDC actually put out detailed guidance to states yesterday as well that goes into this timeline. When a vaccine is identified as safe and effective, which could happen within a couple months, certainly could happen within a couple months, it will then get distributed to high-risk populations. We're talking about healthcare workers, first responders, people who are at higher risk of complications from COVID, elderly individuals. That'll be the first wave, and that'll take a couple months to do. Only after that will there be enough vaccine produced at enough volume to be distributing it to the general population. And what Dr. Redfield said yesterday is you can expect that to be deep into 2021. So I say that not to discourage people, but I don't want people thinking that we can just hold tight, wait for a vaccine to come, and then we'll be in the clear. It's not like that, and there's plenty of time between now and when a vaccine is going to be available for the general public for us to have a third spike. Plenty of reason to do everything we can now to prevent further spread. I don't want people just sitting back and waiting for a vaccine. That would be a mistake. So what keeps me up at night right now, and this is very true for Jefferson Parish, is number one, even though the numbers are going in the right direction for Jefferson Parish, and they absolutely are, there's no question about that, the trajectory is encouraging, but the level is still very high. There's still a ton of COVID out there, particularly in Jefferson Parish, and it would not take much to reignite that. So people really do need to be vigilant and maintain that vigilance, even though it's exhausting, quite frankly. But there's a lot of COVID out there, and it wouldn't take much to reignite another spike. You add to that schools coming back in, universities coming back in session, just more people congregating, more people interacting with each other. That's a risk. We will continue to see cases associated with schools and universities. I think we can mitigate that, but we're going to continue to see cases, and it adds to the risk a little bit. Hurricane Laura has really been a challenge for us in two ways. Number one, there's been a disruption in testing. A lot of the testing that's done across the state is done with the assistance of the National Guard. Testing got put on hold for the past couple of weeks because parishes shut down for Laura and then recently for Sally, and the National Guard got pulled to assist in hurricane operations. So we kind of were flying blind in terms of data, testing data, for the past couple of weeks, and that's concerning. Testing's being ramped back up now. Also, we have about 12,000 displaced individuals in the Lake Charles area currently seeking refuge in the greater New Orleans region. Most of them are in hotels in downtown New Orleans. Some are in hotels in Jefferson Parish. Lake Charles had a lot of COVID. They were one of the leading regions for COVID as of a few weeks ago. And so there's a lot of risk in there as well. And then phase 3 and the potential for bars. The data that supported our progression into phase 3 is not black and white. And the governor said this when he made the phase 3 announcement. He said this was the most challenging decision he's made in COVID yet. I think he was being genuine with that. It's not cut and dry. There's a lot of gray area. And we're, I'll tell you, when we had envisioned phase 3, like in the early stages of COVID, when we thought about what phase 3 would look like, we envisioned much less risk in COVID than we are now. So we're in phase 3, but it's a tenuous phase 3. Bars are going to potentially have the opportunity to open. The governor's order says a parish has to be below 5% positivity for 2 consecutive weeks. And then that parish would have the opportunity to, vote or affirmatively opt in to opening bars. This would be the first week that Jefferson Parish is below 5%. So the opportunity is not there yet. There's a good chance Jefferson Parish will be below 5% again next week, in which case the parish would have the opportunity, if it wanted to open up bars, which is going to be challenging. Bars you're in an indoor space, which is more dangerous, and you're not typically wearing a mask when you're drinking a beer. So it's more transmission risk. All that to say, I think there's a way to do it safely, but it's going to take a lot of cooperation from people and vigilance. For business owners, I think there are some really good things, and quite easy, I think, that business owners can do to make their operations safe. And in the end of the day, that's good business, because more people are going to feel comfortable coming to your establishment. Promoting face coverings and masking in the business is the first thing. And it really does go a long way, particularly when you're in indoors, to prevent transmission. Maintaining distance, 6 feet distance as much as you can within a business establishment, also goes a long way. Making creative use of outdoor spaces. As much as a business, particularly restaurants, can use outdoor spaces, that's going to be safer for their patrons and for their staff. And then 2 additional things. If a business can have their employees continue to work remotely, if they can perform their operations remotely, that's going to be safer for 2 reasons. Less risk of spread straight up, and when someone is positive, there's less damage. People are going to be positive because there's COVID in the community. And if they hadn't been in contact with half the office the day before, then that half the office doesn't have to quarantine. It's like putting up a firewall. It limits the spread, limits the quarantine you have to do. So the businesses that have been able to continue to operate with a good mass of their staff virtual have been able to keep them working throughout these COVID instances, so they don't have to do the quarantines that you have to do when the whole office is in person. That's number one. If people do need to show up in person for work, and there are some businesses where it's unavoidable, maintaining good sick leave policies, making sure that employees feel empowered and really able to stay home when they're sick, goes a long way. I can't tell you how many cases we've had of, for example, service industry or hospitality industry folks who came to work sick because they didn't have sick leave, or they felt pressured to do so. So making sure employees on the team know that if they're feeling sick, they have a way to to stay home without personal loss to them goes quite a long way. And at the end of the day, really, I think, the more that a business can do this, the more attractive it's going to be for patrons. And with bars potentially on the horizon, again, this week it's not on the table, but next week it might be. Folks are just going to have to be careful with it and still distance and take it slow. I think that's the only way to do it. But again, the progress that Jefferson Parish made has been considerable. I think people should be proud of it. It shows that we can change the course of this pandemic. And to be completely honest with you, we're going to have to continue doing that because it's still going to be a number of months before there's vaccine out there for the general public. So it's going to be a few more months. We're going to have to maintain this vigilance, and I know we will. So we've got maybe a couple minutes left, so I'll stop there. And Alex, I'm happy to answer any questions if there are any.
Thank you so much, Dr. Cantor. I just want to welcome everybody to submit any questions that you might have to the Q&A section at the bottom of your Zoom window, and then we'll address them from there. So you're welcome to submit questions through there. You can also use the chat function if you're more comfortable with that. All right.
I stumped everyone.
I know. Let's see. Okay, we have a question.
Question came in through chat. Is it still true that vitamin D plays a role in the virus? There's not great data to that. There's really not great data to any vitamin or supplement that it really is protective in the virus. A lot's been said about zinc, but there's not good data for that. What we do know is people who are vitamin D deficient are more likely to get sick when they're exposed to any number of infections. The flip side of that coin is vitamin D deficiency is pretty rare. So for someone who is deficient for some reason, it would be beneficial to take supplements, but that doesn't mean that if you're not deficient, taking extra vitamin D gives you any more protection. We don't think it does. But if you really don't get outside at all, you don't get any sunlight, or you believe to be vitamin D deficient for some other reason, I think in general it's probably a good idea to take vitamins. And you can get enough vitamin D in any type of like daily vitamin supplementation that you can get over the counter.
Thank you. Matt Broussard said, Dr. Cantor, what safety steps can bar owners take to make their employees and customers safer during and after reopening? Would you encourage more bars to reopen smoke-free? Can you address the relationship between smoking/vaping and COVID?
Yeah, Matt, those are great questions, and they all give me a lot of heartburn, to be honest with you. So I'll talk about smoking first. I mean, I think bars should be smoke-free anyway. I mean, I think it's the data is clear now. Secondhand smoke is a health risk, period. But that's a separate issue. For COVID particularly, it's a risk for a couple of reasons. Anytime that you make someone cough, they are at increased risk of spreading out viral particles should they be infected. And the real challenge in COVID is that so many people are asymptomatic. Between 40 and 60%, we think, are infected and infectious, able to spread it and have no symptoms, have no idea. I could be infected right now. All of us on this Zoom could be infected right now and have no idea and still spread it. So anytime that people are induced to cough, it just increases the risk that they're going to spread. And there is other evidence that smoking and vaping, aside from the transmission risk, make people more likely to have serious complications if they do get COVID. So it does increase the risk. I would encourage bars to be smoke-free anyway, but particularly because of COVID. Now, down the line in the future, you know, if a bar would open up, there are some things that are going to make it a safer environment from a COVID perspective. The more they're able to utilize outdoor space, the better. The more they're able to limit the capacity of the people indoors, the better. The more they're able to keep windows open and have outside ventilation coming in, the better. The more they are able to make it look like a restaurant. Seated at tables, table service, you know, waiter to the table, the better. That's actually what the rule is. It has to operate like a table service restaurant. But what we don't want is typical just mixing and congregating in a bar, because then you just exponentially increase the amount of interactions between people. And when people are not drinking, if they can put a face covering back on, that would go a long way as well. So bars are not going to look like what we're typically used to. I mean, that's not, look, people usually go to bars to hang out, have a drink, meet people, talk to people. That's going to have to be tampered down. There's no question about that.
Thank you. I saw that Kathy Flynn raised a hand, so I'm going to unmute Kathy. Let's see.
You there? Can you hear me?
I got you, Kathy.
I just wanted to say great information, thorough. I'm not surprised that there's not a lot of questions because you answered a lot during your talk. So that was really good. It was a good overview for us.
Thanks, Kathy. I appreciate that.
Thank you. All right. Linda Marshall said, what about Saints games at the Superdome? What do you advise?
It's a loaded question, Linda. I don't think it's anyone's decision here, and that's probably for the best. I will say, let's just talk about sporting events or gatherings in general. Any type of gathering, whether it's a high school football game or whatever, the stands right now are going to be limited to 25% capacity. And in that setting, if that's actually what happens in the stands, if people have a couple seats in between them and someone else, and particularly if they're wearing face coverings, I'm not worried in that setting about a lot of transmission while people are seated in the stands. I am worried about all the lanyard that goes around it. The ingress, the egress, the tailgating, the hanging out in the parking lot after the game. That's getting into the stands, leaving, going to concessions, going to the bathroom. That's where I see the transmission risk being. And I think, particularly advice for like a high school that's going to try and get high school football games back up is they're going to have to be really cognizant about how they do crowd control before and after the game. Make sure that people are not congregating, hanging out, make sure that the ingress and egress is really controlled. So I think that's going to be the bulk of where the transmission risk is. And as for the Saints, I hope they keep winning. I'll leave it at that. I think you're muted, Alex.
Thank you. That I think we should wrap up our Q&A just because of timing, but I can't thank you enough. I know that everyone on this call really appreciates the time that you took to put that recap and update together, and just provide a great overview of information for us. So I really appreciate it. Thank you.
My pleasure. Thank you.
And now we will pass it over to Jennifer for our mindfulness activity today.
Hi, guys. All right. So first, I do want to ask that everybody engages in the activity. So just try to get yourself relaxed. And first, we want to do a presence exercise and then a reflection exercise. It'll be brief. So first, look around, and we're just actually silently name 3 things that you can hear, whether it's like birds chirping, a clock ticking, wind or your air condition blowing. Just name those to yourself. Two things that you could see. Now you could do 1 or 2 sensations that you feel, whether it's like air brushing against your skin, your arm touching a chair, or it's the clothes that you're wearing. Now close your eyes and reflect on something pleasant that occurred in the past. Any sort of pleasant experience. And now just pay attention to what emotion arises, whether it's happiness, excitement. Now take a moment to check in with yourself and feel that emotion. And just feel how your body responds to that emotion. Usually feel more at ease, more relaxed. You could open your eyes. And this is just something that you could do anytime throughout your day. It's bringing you to the present moment where you're paying attention to things that you don't normally pay attention to. Take a walk outside, look around, and just notice and listen and feel. A lot of times we're walking around like we're robots, or just going with emotions where you don't necessarily pay attention to things like that. And just checking in with yourself with feeling will help ease those wandering thoughts where you just can't stop thinking about what you have to do later or tomorrow, what you did yesterday. It brings you to the present moment. Okay. Thank you all for participating, and I'm going to turn it over to Jody.
Good afternoon, all. I'm going to share my screen, and as I'm getting that up, my volunteer partner, Kurt Kemper, a retired lawyer, is going to start us off with our presentation. So I'm going to put my screen up, and he's going to say a few words, and then we'll get started. Thank you.
Can you hear me? Hello?
Yes, yes, we can all hear you. Thank you.
Okay. Yep. As Jody said, my name is Kurt. I'm a retired attorney and investment banker. We're going to be discussing with you today a program that the Red Cross helps to administer called Ready Rating. And what we like to do is to give folks an overview of what's going to be covered, so they can see the forest before we get into the trees. The forest looks like this. The first thing we're going to discuss is why we're running this program. The second thing we're going to discuss is what the program is. The third thing is how you participate in the program. And the last thing is what your expectations should be from participating in the program. So I'll start with the why. Basically, Ready Rating is devoted to the idea that employers and businesses should be prepared for the oncoming train wreck. And unfortunately, in today's society, there's a certain inevitability about that. Whether you have a fire in your business, a hurricane, a forest fire, COVID, an active shooter, all of these issues are now facing modern businesses. On top of that, if you're an employer of 10 or more, OSHA requires you to have a disaster preparedness program. And to quote the good Dr. Cantor from before, if you have 10 or less, it's just good business for you and your employees to have a program like this. So the impact of it is very far-reaching, and the good news is it's pretty easy to implement the program. So I'm going to go ahead and let Jody describe what Ready Rating is and how it operates. Obviously, we'll save as much time as we can for questions at the end. Thank you.
Thank you so much for that. I wanted him to kind of start us off. We do that here at Red Cross. We utilize our volunteers and could not do the mission without. So can you all see my screen? and the slide presentation. Just a thumbs up from Jennifer will do. Okay, I got a grin. So ready rating, what is it? As Kurt alluded to, disasters are on the rise and more people are affected each decade. I'm on camera. Sorry about that. Nearly 21 million U.S. adults are affected, and as you can see from one decade to the next, it is on the rise. So Red Cross in 2008 developed this program called Ready Rating, and it's really it's for all organizations, and they did studies and found out that the majority of organizations are not prepared. As many as 40% of our businesses fail following a disaster, but only 62% of small and medium-sized businesses have emergency plans in place. So these include businesses all the way from small, medium, it can be nonprofit, house of worships, it can be insurance companies, it can be the gambit. It's not just for one typical type of business, it's for all businesses. So the solution is the Red Cross Ready Rating program, and what it offers is a free membership. It has online accessibility. It's easy, self-paced, and it's for you. So you utilize the tool at your own pace. We have tools to create an emergency action plan. We give customized feedback. It helps fulfill that OSHA standard that the doctor and Kurt alluded to, and then it helps build your preparedness teams, meaning your employees. As a Ready Rating member, you can measure your organization's current preparedness level. So you will take an assessment. We'll get into that in just a minute. But you take the survey and you find out where you are currently. And I always like this part of it because when I go and I talk to family and friends who own businesses and I say, hey, will you take the survey? They do. They think they're so prepared, but this is on a scale of 1 to 100, and they're competitive, and they're like, oh, I think I'm about a 70. Well, when they take the survey and they come out and they're really only at 40% readiness, that's really an eye-opener for them. So it also helps your organization improve its emergency action plan or create one if you don't have it. It provides tools that are needed so that your employees know what to do if something were to happen. Kurt alluded to disasters, not only natural disasters, but man-made. We have more and more shooters. We have more and more protests taking place. We have the pandemic. And a lot of times as business owners, we may have a plan, but you don't share that with your employees, or the employees don't know what is that plan if somebody comes in and there's an active shooter on the site, or what happens if somebody drops down and is having a heart attack or a seizure at your place of employment. They're not sure what to do besides call 911, but then what do you do with the customers? What do you do with those family members? What do you do with that person? So again, all of this information is available through this Ready Rating tool. It also helps you track your progress. So as you start and you do the assessment, it keeps track of your progress over the days, months, and years that you're a part of that. And then it makes getting prepared simple, cost-effective, and also achievable. Current Ready Rating members include all business sizes, house of worships, nonprofit, again, healthcare, real estate, it goes to the gambit, professional, insurance, financial institutions. It's available for all. It is not just a cookie cutter, it is available for all sizes and types of businesses. Members who have utilized our Ready Rating find that the service is good to excellent. They also find that once they become a member of Ready Rating, that they continue to use the tools year after year to make sure that they are prepared and that they are ready. And they also, 70% of them also too, share it down the food chain with their employees to make sure that their employees know what the plan is. And then they actually practice that plan. And then members have increased their preparedness scores, some by as much as 40% from the very first assessment they've taken. They use the tools, they do a little bit of studying, and they've actually increased their scores up to 40%. Becoming a Ready Rating member is very, very easy. You enroll on the website of www.readyrating.org. You accept the Ready Rating membership agreement, and then you complete one of 2 self-assessments, which at the end will give you a current preparedness level score between 1 and 100. The 2 choices depend on you. It's Ready to Go, which is the short 25-question assessment for fast evaluation that focuses on core functions that affect preparedness. The more advanced is called Ready Advanced. It is a comprehensive 60-question assessment, which delves deeper into your organization's response and planning effort. So it really depends on which one you want. And the nice thing is if you start with the fast one and you only have time for that, but you're interested and you ever want to take the Ready Advanced, you can switch back and forth from one to the other. The assessment sections really looks at participation, demonstrates commitment to preparedness. What are you already doing or what aren't you doing? Emergency planning demonstrates understanding of most likely hazards and the potential impacts. Facility and equipment, what do you currently have in your business and what maybe are you missing? Do you have a first aid kit? Do you not have a first aid kit? Do you have an AED? And if you don't know what that is, that's an automated external defibrillator. If you own a gym and you have more than 20 members that are paying membership dues, you're supposed to have an AED on site. So stuff like that. Some business owners don't even know what that is. Training and exercises. Ensures staff is properly trained and skills are practiced, just like we do at home in our own homes with our families. And we have fire escape drills. Hopefully you're testing those smoke alarms and you're able to get out of the home in under 2 minutes. You also want to be able to do that with your places of business. You should have exercises, you should have training, you should have yearly times where you're actually doing that with your employees, so that if they do hear the smoke alarm, they know what that expectation is. They know what your smoke alarm sounds like. Where is your where is your first aid kit? Where is your AED? Where is your your fire extinguisher if you have one. And then number 5, extended community, demonstrates commitment to the wider community. When you have these modes in place, you're wearing your mask, or you have those first aid kits displayed, or you have the AEDs hanging on the wall. When people come in, that just gives you a higher up step in esteem. They look around and they see that you're prepared. They see that sticker on your window. They feel comfortable coming into your establishment, knowing that you all are, you have a plan. So here's a screenshot of what the assessment looks like, and I know it might be hard to read for some of you, but it just kind of goes into some of the questions and how easy it is to look at. The website is awesome. It's up to date. It's very easy to use. It's got the questions, a yes or no button, so you don't have to really hunt and peck for anything. And then the customized next step report. This is what usually everyone gets really excited about. They take a survey and then right away in your inbox, you get that next steps report. So it gives you that score of 1 to 100. If you didn't do so well, it will give you, this is what we recommend that you do for next steps to increase your score. It outlines recommended actions. It helps you on the website. It tells you in the resources which videos to maybe do, which exercises to maybe do with your employees. And so it really gives you a customized next step report for your business. It helps the members to improve your score by completing those recommended steps and then encouraging you to take these assessments regularly. Here is a picture of the resource page, which again will go into and the assessment. It shows you exactly, like if you didn't do so hot on a question, it gives you the resources right there. So if you answered something and you answered in, maybe it was false and it was supposed to be true, it gives you those resources at the bottom to be able to look at to help next time increase those scores on your assessment. Again, that resource center it's got checklists, it's got sample forms, it's got videos on there, short videos that you could actually show to your employees for on-the-job training. It has emergency action plan templates, and these are usually the resources that most people like, because you really should have an emergency action plan for any sort of disaster that can happen. If a fire happens, what are the next steps? If someone comes into the business with a gun, what are the next steps? If a hurricane is coming and we need to close down, what do those emergency action plans look like? Where are the employees going to go? How am I going to get in touch with them when we're going to open? All of that stuff is laid out in an emergency action plan, and the templates are really fillable. You fill it out with the information that you need for your business and that is apropos to your business. And for the section in there that you don't need, you can just delete it out of there. More resource topics. It's basically, it goes down through all of the sections of the assessment. So it has the participation, it has emergency planning, it has facility and equipment. What should you have in your facility, and how can you find this equipment? Training and exercises. It has different trainings and exercises that you can do with your staff to be prepared. And then again, the updated videos that you can watch. There's more than 25 videos on topics, which include that emergency preparedness, and it's given by multiple experts in the fields. And these are updated. Whenever something new comes out, they update these videos. And then again, we kind of talked about the template. There's an easy go template, or there's the advanced template. So as you're kind of going down through there, you can address what fits your organization. But as Kurt alluded to earlier, there is a minimum standard by OSHA, and those templates do meet those needs, and they are fully customizable, and you can do it right there on online on your computer. And this is just a screenshot of what that emergency action plan template generator looks like. The Ready Rating dashboard, this is the, once you become a member, you have a dashboard that you can go back in and look at. And what it does is it gives you a current snapshot of your current actions that you're doing, your latest assessment score, access to your next steps report that was generated, access to your emergency action plans that you've created, and then your Ready Rating star rating. And this is a sample of what your own company's dashboard would look like. It would have your name at the top, and then it would have your assessment score. And so again, very easy to read, very, very user-friendly. If you are a business owner and you have more than one facility, you can actually do this by using the shared organization ID. So you can have multiple sites underneath your business. So say, for example, you're a Subway owner and you own four different chains, or excuse me, 4 different restaurants in Mandeville, or excuse me, in Jefferson Parish, and you have them throughout the parish. You can actually cascade those down so that you're able to, in a one-stop shop, see all of the different scores for all of your different locations. And then member communications, you will get a newsletter, and you will get, upon joining, you will get a welcome message, and it will encourage you throughout emails to continue to take those assessments yearly, periodic reminders to update your assessment if it hasn't seen any movement. And then again, you'll get quarterly, you'll get those member newsletters with any new updates that have come out. And then the benefits of joining Preparedness Made Simpler. You are in control of your own business. You're in charge of the process, timeline, and actions that you wish to take to improve your organization's level of preparedness. You have access to easy to understand assessment report cards, and then the next step reports. You can watch your preparedness level improve as you use the resources and continue to take those assessments. And the benefits are free, thanks to our generous sponsors of the American Red Cross. And then performance highlights as of December 30th, 2017, there are over 14,700 Ready Rating members. And I can tell you that as of 2020, there's actually over 20,000 Ready Rating members throughout the whole United States. Members love the Ready Rating. Members are taking action, taking charge of their own preparedness, and they are excited when they see their scores continue to approve. So action items, next step, join Ready Rating, go to readyrating.org. You register online, it takes less than a minute. You can measure your preparedness level by either using the fast Ready Go assessment, which takes less than 30 minutes, and that's 25 questions, or you can choose the Ready Advanced assessment, which is about 60 questions, takes about an hour, and then you'll get your next step report and you can start improving your preparedness. So in order to help protect your organization, staffs, client, and communities, we recommend the Ready Rating program for you and your businesses. Thank you so much for letting me go through the readyrating.org. If you have any questions, I will turn that back over to Alex for any questions. Thank you.
Awesome. Okay. Thank you so much, Jody. I cannot believe that that entire program is free. It seems like such an amazing resource, and just also a way to get more credibility for your business. So I really appreciate you joining us today to present it and explain how to use it. If anybody has any questions for Jody, please feel free. You can submit those to the Q&A, or you can use the chat box, or you can raise your hand and I'll enable you to talk, and you can just ask your question by speaking. We can do this any way that works for you. Let's see. Susan said, great info on Red Cross program and from Dr. Cantor. Just giving people a second to ask their questions. Okay. All right. I guess one question for Jody that I had, and I'm sorry if you already answered this because that was just quite a bit of information, but does it give you recommendations based on the specific like industry that you're in, or like if you're like what you were talking about, like the type of people that you serve or how many people are coming in and out?
It gives it based on more about the assessment and the questions. So it's not so much industry driven, but it's how you answer those assessments. So it doesn't delve down into each industry. It's more about how you answered those questions in the assessment.
Okay, thank you. All right. Let's see. Okay, Tisha said, yes, I'm really surprised the program is free. Can we get her information in the event that we look further into it in the future? Absolutely. I will go ahead and actually share my screen, which has everyone's information on it. So at the very bottom, just for all participants, if you're looking to reach out to Jody, here's her email. Jennifer can be reached here, and Dr. Cantor, his Twitter handle is provided as well. So if everyone just wants to take a second to either screenshot that or just write it down quickly, we're happy to provide everybody's contact info so that you can have them as a resource moving forward. All right. Coretta said, are there any specific resources that Ready Rating has for businesses returning from a disaster, such as a hurricane, et cetera?
So that is a great question. I don't know all of the resources on the Resource Center. If it's not there, I do know that we do have it on our redcross.org site, especially for those returning from like Hurricane Laura, stuff like that. So I am not adept at what everything is on the resource. I believe there is specific to returning from a disaster for businesses, but if it's not on Ready Rating, I know it's on the redcross.org site. And if that person wants to contact me, I can definitely look into that and find the link that would take them right to that.
Thank you.
Mm-hmm.
All right. Let's see. Well, if there are no more questions, then I think we can wrap up for today. But again, I just want to thank our speakers for giving your time today and preparing for this to share all of your expertise with our attendees. And I also want to thank our attendees for tuning in and participating as well. So I hope you all have a great Friday and weekend. And thank you very much. We'll see you next time.
Thank you.